Now this is very important. We're going to get into shrink speak for a minute, but it's important that you know that because this is a phenomenon that actually takes place in every helping relationship. Has anyone here ever heard of the term transference? Okay, transference is a phenomenon that we notice and we analyze and process in the psychotherapeutic relationship, whereas the authority figure, we become a symbol for one or both of the client's parents or other authority symbols in their life. And you know, usually a client who is in psychological trouble or in legal trouble many times didn't really have an optimum relationship historically with one or both of their parents. So when that happens, they are unconsciously putting on you any negative feeling, any upsetting feeling they might have about that parent. And so they may become irritated at you, short with you, critical of you, question your professional judgment, or they could go the other way, where they worship you, which is not any better. You know, when somebody tells me, oh, Ellie, you are the most wonderful one, I'm like, yikes, I don't want to be that. So in your helping relationship, you need to be very aware of the phenomenon of transference because that client sees you not only as their lawyer, but whatever you symbolize to them in the way of a parental symbol. Well, conversely, the same thing happens to us. You may get a client from time to time that will remind you of one or both of your parents, the good things and the bad things. No one had a perfect upbringing. We all had good stuff and or bad stuff, some in different ratios to the other. But there may be a client from time to time that is going to help stimulate that hippocampus in your brain and is going to trigger for you upsetting memories. So now the client is telling you an upsetting story. The story is reminding you of some aspect of your own history, your own background. Now your trauma response is exponentially intensified because now you're having secondhand shock perhaps from the story itself, and you're having some old trauma or shock from a memory it triggers in you. Does anyone have a sense of a client or a person that just pushes your buttons?
Okay, come on. Tell us the kind of client that most upsets you. What kind of people trigger you when you're around them? Yes.
People who won't tell you the truth.
Liars. Okay. What else? What other kind of people may come to you? Oh, you're far away. Okay.
Negative people.
People who are always negative.
People who see the downside of everything. We have one back there.
People that are hypercritical.
People that are very critical or judgmental, that really pushes your buttons. This kind of awareness is so important because guess what? If someone is hypercritical, someone is judgmental, if someone is very negative, that's about them. If we get upset about it, that's about us. And I'll tell you, I hate it when it's about me. I really like it best when it's not about me. But it's important to know that. And the reason why you may have a reaction is because of your own history. So one of the things we want you to start to become very close to and very intimate with is your own development, your own history, your own evolution, the players in your life, your relationships with authority figures in your life, what was good about it, what was trying about it. Because when you are listening to upsetting stories, and it happens to be with a type of person or a story that has something to do with your own history that may be painful, you are really going to get a double whammy of secondhand shock, and you are going to get an intensified chemical reaction in your brain. If you remember that brain picture, we've got that hippocampus there, and we've got the amygdala. The amygdala gets stimulated, the relay station starts, memories get triggered, and now you're feeling on an exponential level. Not only the empathy for the client that you have to control, but now you have to control your own memories from coming up to the surface. Reason why we tell you this? These are body memories. It doesn't bother me so much that you may remember it cognitively. It's all the other chemical reactions that memory trigger in your body that put you at risk.